Good day everyone, I'm Kimberly Solis, one of the last reporter for this subject. For this video, we will tackle about the two fundamental rights, the right to health and right to education of indigenous people, and the problems that prevent them from enjoying these rights. We will also look at laws, challenges, and recommendation to prevent these problems. Before we proceed, let's have our objective. At the end of the lesson, students must be able to explain the right to health and the right to education, analyze challenges of indigenous communities faced in assessing these rights, and actively participate in class discussion and group activities. Let's have first the right to health. So what is right to health? The right to health means that everyone has the right to access quality medical care, clean water, nutritious food, and a healthy environment. The right to health means that everyone, not only selected, have an access to good medical care, clean water, healthy food, and a safe environment. For indigenous communities, this also includes respecting their traditional healing practices, so dili lang dapat hospital ang choice. They should ha they should be allowed to use their herbal and cultural healing too. These are the policies that support right to health. First is the Indigenous Peoples' Rights Act of 1997 or the Republic Act number 8371. It recognizes the IP's right to access all social services including health. It guarantees the right to health services that respect IP's custom, traditions, and beliefs, and it supports the integration of indigenous health system and practices into the national healthcare system. In this law, specifically in the section 21 and 25, it says IPs must have access to basic services like healthcare in ways that respect their tradition. Second, the Universal Health Care Act of 2019 or the Republic Act number 11223. It ensures equitable access to quality health services for all, especially marginalized groups like IPs. It mandates the automatic inclusion of all Filipinos, including IPs, in the National Health Insurance Program, and it promotes culturally sensitive health programs and services in geographically isolated and disadvantaged areas where many IPs reside. This law includes all Filipinos, including IPs, in the PhilHealth system, and it also promises to bring health services to remote and poor areas like the mountains where most indigenous communities live. The next one is Executive Order Number 70, Series 2018, or the Whole of Nation Approach to End Local Communist Armed Conflict. This includes provision of basic services like healthcare to IP communities as part of peace and development programs. This executive order helps solve local conflicts by bringing development programs like healthcare into indigenous area. So party siya sa peace effort na naay medical services for far communities. So the next one is the Department of Health Administrative Order number 2015-0050, or the National Policy on the Inclusion of Indigenous People in the National Health Agenda. It aims to reduce health disparities affecting IPs. It promotes intercultural health approaches and the recognition of traditional healers and practices. And it supports capacity building of health workers to respond to the unique needs of IP communities. This DOH policy says that indigenous culture must be included in healthcare planning. For example, health workers should understand IP languages and beliefs and even work together with traditional healers. So the last one is the Local Government Code of 1991 or the Republic Act number 7160. This empowers local government to deliver basic health services to communities including IPs, especially in remote and underserved areas. This law gives LGUs the power to deliver health services, especially to those remote areas. So barangay and municipal government should give a clinic, health workers, and mobile check-up to reach IPs. So those are some of the policies that support right to health of indigenous people. So, so let's now proceed to challenges to the right to health of indigenous people. So first is the geographic isolation. Many indigenous communities live in remote areas with limited or no access to healthcare facilities, making it difficult to obtain timely medical services. Next one is the poverty and economic constraint. Low income levels hinder the ability of indigenous people to afford healthcare services, transportation, and essential medication. One of the challenges also is language barriers. A lack of healthcare providers fluent in indigenous languages hampers effective communication and limits understanding of medical instruction and health information. Also, cultural insensitivity in healthcare. Mainstream health system may fail to recognize or integrate indigenous culture, practices, and beliefs, leading to mistrust and reluctance to seek care. Also, land displacement and food insecurity. For indigenous people, the loss of ancestral land is equal to less food. Thus, it affects their nutrition and health. Lack of health education. Limited access to education reduces awareness of preventive health care, sanitation and reproductive health, and disease prevention. The last one is discrimination and stigma. Social and systemic discrimination against indigenous people often result in lower quality of care or outright denial of services. All those challenges adds up and make it very hard for them to stay healthy. To prevent those challenges, these are the possible ways to improve healthcare for indigenous people, involving indigenous communities in designing and implementing healthcare programs to ensure cultural sensitivity, educating healthcare workers on indigenous cultures and languages to improve communication and trust, providing healthcare services in remote areas through mobile clinics, supporting traditional healing practices alongside Western medicine where appropriate, protecting indigenous territories to ensure access to traditional food sources and sustainable livelihoods, and implementing legislation to address health disparities faced by indigenous people. So let's now proceed to right to education. The second one is the DepEd Order number 62 series 2011 or the National Indigenous People Education Policy Framework. This order started the IPED or the Indigenous People Education Program, which helps schools create learning environment that respect the culture and needs of IP learners. The third one is the DepEd Order number 32 series 2015 or the Policy Guidelines on Indigenous People Education or the IPED program. This guideline is for how IPED should be applied. It encourages teachers to use local examples, involve elders, and allow community participation in lesson planning. The last one is the Republic Act number 1053 or the K-12 law. This law supports mother tongue-based multilingual education, which includes indigenous languages, so students can learn using their own first language. It also values local knowledge and culture. So that's some of the policies that supports um, education. Various forms of interventions done by EPAs and religious congregation were any or a combination of the following. Um, like the basic literacy, livelihood education, scholarship to support to enter school, and also school buildings. This help more IPs enter and stay in school. So why education is important? To understand the system of transacting business in the marketplace, to read street signs, newspaper and legal documents and to vote and participate in activities outside their communities. Um, the need for other livelihood options because the community's resource base or finding employment, um, to access health services and going to school is equated with being educated, and education means liberation from poverty. Even with support, the indigenous people still face um, school as a venue of discrimination, prejudice, financial problems, um, comprehension difficulties, and also difficulty adjusting to school culture. All of these make learning very hard for them. So to make it easy for them, a better solution is to make education fit them, not force them to fit the system. Use their local language, involve elders, and make lesson connected to their way of life. In that way, they feel included and respected. Remember, Indigenous people have the same right as everyone else, but they need more support and respect to truly enjoy them. So let's do our part to make their voices heard and their rights protected. So that's all for my assigned topic about right to health and right to education. So I hope you learned something from this video and thank you for listening.